So you're running. Hi. So I'm Carolyn Bourdeaux, and I am running for the 7th Congressional District. And one of the reasons I'm running is around healthcare and defending people with pre-existing conditions. A few days ago, I talked to a hairdresser in Swanee who told me that she'd purchased her health insurance on the exchange. She had 5 blood clots in her lung and brain over the past few years, and that is a pre-existing condition. And she said without her ability to purchase the insurance on the exchange, and without the guarantee for folks with pre-existing conditions, she would be dead. Rob Woodall, our congressman, has voted at least 19 times to repeal the Affordable Care Act, including provisions to eliminate the requirement for covering people with pre-existing conditions. There was no loophole in this legislation. There was no amendment exempting this provision. Now the Republican attorneys general, including Georgia's attorney general, have filed a lawsuit that would also have the effect of eliminating the requirement for coverage of pre-existing conditions. The Trump administration is refusing to defend the law, and Rob Woodall has said nothing. He has done nothing to defend people with pre-existing conditions, even in the face of this life or death threat. Rob Woodall tells us not to worry, and that is what he said at the debate last night. This is the law of the land right now. But you know, Congress can change the law, and he has voted repeatedly to eliminate this provision. The courts can overturn the law, and Woodall has said nothing. Over 50,000 people purchased their insurance on the exchange in this district, more than any other district in the state, and more than many other districts in the country. And this is because we have so many wonderful entrepreneurs and small businesses. But this also means that we do not rely as much on employer-based coverage or different types of government coverage. I am here to take a stand for ensuring that every man, woman, and child in this district has access to affordable, quality health care. Thank you all so much for coming, and I'm going to turn it over to one of the people of the 7th District to talk about what that kind of coverage for pre-existing conditions means to him. I'm going to introduce here Dirk Bender. Thank you.
Hi, as Carolyn pointed out, I am Dirk Bender, and I'm 60 years old and live with my family in our home in Sugar Hill. We moved here back in 2001. I've been very fortunate in as much as I've been very healthy and physically active for most of my life, and I've been able to work and earn a good living for my family. I had been employed for 8 years with a company that had provided employer-subsidized insurance, but the company laid off more than half of its employees in early 2016. And that really wasn't a disaster for me because I was able to go and get myself a pretty good paying contract job only a few weeks after I was laid off. However, like most contract jobs, this one did not provide medical benefits. There was no subsidized insurance involved, but that wasn't a problem either. I was able to go to the healthcare.gov site and purchase a plan for my family that covered us in almost exactly the same way that my company-sponsored health insurance had done in the past. We really noticed no difference whatsoever. We had the same providers. It worked out very, very well for us. Late in the summer of 2016, I learned that I had developed a very serious condition, a blood cancer I'd never even heard of, called multiple myeloma. Before it was done wreaking havoc on my body, I had 15 fractured vertebrae, and I'd lost 6 inches in height. The condition obviously required weeks of hospitalization and chemotherapy and radiation treatments. Now, cancer treatment is never inexpensive, even if you have insurance. But my coverage ensured that we were able to cover this new normal thanks to the patient protections that are imposed by the PPACA. Today, I take a daily maintenance chemo drug, which is included in my coverage. It lists for $20,000 for a 28-day supply. This drug's manufacturer earns consistent annual billion-dollar profits as a result. All efforts to bring these practices to heel have been stymied over the past few years by moneyed interests in Washington. Now, I'm represented by Rob Woodall, a man who voted 19 times to remove these protections, to throw us patients with pre-existing conditions to the tender mercies of the free market. whose policies would have meant financial ruin for families like us. I'm standing here with Carolyn Bourdeaux because I know she will fight for quality, affordable health care in Washington. She understands the struggles we have gone through with health care, and I know she will fight hard every day to expand coverage and lower costs for families like mine. Rob Woodall cannot be trusted to solve our issues. We must elect Carolyn Bourdeaux, someone who will fight for families like mine. Thank you.
Okay. We're opening up. Thank you so much for doing that. I appreciate it.
Thank you.
All right. And we're opening it up for questions.
I guess this argument or this policy platform, how has this compared to you as you've listened to people in the community? How does this one stand out to other priorities that people really have? Is the reason you're having this event because you've gotten so much feedback on it, or is this something that is coming from you?
Yes, right. So I have talked with, I have heard hundreds and hundreds of stories about nightmares with our healthcare system. And this is one that is very straightforward. But yes, there are so many people out there who would be terribly hurt if they lost coverage because they had a pre-existing condition. And yes, we hear it all the time. I have knocked on doors and had people just burst into tears because they are afraid that they're going to lose their health insurance coverage.
And when you kind of have presented this to Representative Woodall, what is his argument, and how, can you summarize kind of his position on this, why he's voted this way?
Right. So, no, I do not understand. I honestly do not understand why something so obvious is not something that, would be front and center in his agenda. And I have to say, one of the reasons I'm running is because I don't understand why our current leadership is not willing to stand up for folks to get health care. Last night he talked about how it was the law of the land and it's not going to change, so don't worry about it. But that's obviously under threat, both from Congress and from the courts. And he is not out there defending people. I don't know what else to say.